Hi, this is Frankie, and today I'm going to cover frequently asked questions that patients ask me before going to sleep. So one of the things that patients ask me all the time is how are they going to be breathing after they're put to sleep? So obviously you've already seen these masks and you've seen a lot of movies where the mask is placed over the patient's face and we're able to ventilate them by using this bag from the anesthesia machine, and I press on the bag and deliver oxygen. So what we're going to do right now is we're going to simulate your lungs with this other bag. So let's just pretend that I'm connected to your endotracheal tube and this is your lung. By pressing this bag, I inflate your lungs, as you can see, and I'm able to ventilate your lungs, and you see it going, stretching out and coming back as I am bagging with this patient. Now obviously I don't have to be doing this the whole time during the procedure, because since I have my anesthesia machine here, I can just turn on this ventilator, and this ventilator here, I'm able to set how many breaths per minute I want to deliver to the patient. As you can see here, my fake lung is inflating and deflating. So I'm not going to have to continuously be bagging the patient with my hand, since the ventilator is going to be doing the job for me. And that way I'm going to be able to be giving anesthesia, delivering anesthesia gases and oxygen and breathing for the patient the whole time. The other question my patients have a lot is how I'm going to deliver anesthesia medications into their IV. So this is an IV catheter, an angiocath, and it's hooked up to my IV line, and here I have my IV bag that I'm going to be using to give fluids to the patient, and I have these ports where I'm able to deliver medications through, and it'll go directly into their vein, and as I open my IV, as you can see, the fluid will go in to the patient. So that's how I'm able to hydrate the patients and deliver medications directly intravascularly. Next, my patients always ask me, how am I going to pee, or can I pee before surgery? The way you pee after you're under anesthesia is we insert a Foley catheter, which is a catheter like this. Obviously this one has been opened and I won't be using on any patients, but this catheter is inserted sterilely into their urethra, and all the urine will be collected in this bag. And this is one way that I can monitor their fluid status, is by checking how much urine they're producing during the procedure itself. A lot of times when the patients wake up in recovery, obviously they'll have this Foley catheter still inserted, and they'll feel like they have to pee, and they'll tell the recovery room nurse, oh, I feel like I have to pee, I have to pee. Well, actually, it's because this catheter is in there, is that they have that constant feeling that they have to urinate. But we just tell them to go ahead and urinate, and it's just going to go within this tube and be collected in this bag. And before you're discharged, this Foley catheter will be removed. The next question people ask me most of the time is, how do I go to sleep and how do I wake up? So going to sleep is pretty easy. After I have the IV catheter inserted, you're lying down and I've given you a few puffs of fresh 100% oxygen. All I do is I inject the propofol into your IV, and before 3, 4, 5 seconds, you're going to be out. Right after you're asleep, I am going to ventilate your lungs with a mask and my bag here. And as soon as I feel it's secure enough, I'm going to secure an endotracheal tube in your mouth in order to continuously give you oxygen and anesthesia gases the whole time during the surgery. What actually happens for you to wake up is I turn off, usually this gas is on. This is one of the anesthesia gases that we use. There's actually two types of anesthesia gases. These are the vaporizers. And I turn off the anesthesia gas, and as you start breathing the anesthesia gas out, you start waking yourself up. So there's actually no medication that I actually give to the patients for them to wake up. It's just the fact that I stop delivering the anesthesia gases that are keeping you asleep that is going to make you wake up. So the longer the case, the longer it takes for you to wake yourself up, because more anesthesia gas is accumulated in your body during that time. So lastly, I don't get this question a lot, but every now and then a patient will bring it up and they're concerned that they're going to soil themselves while under anesthesia. And what I like to say is it's very rare that a patient will have a bowel movement while under anesthesia. And anesthesia itself, some of the medications that are given, they actually slow down gastric emptying and your bowel movements. So it's very rare that someone actually ever has a bowel movement while under anesthesia, but it has happened before, and you'll be cleaned up and taken to the recovery room like every other patient. So I hope this clarified some of the how do I questions that I get every now and then from patients through my DM. Always happy to answer any questions you may have. And until next time, stay safe.